we spent the first half of this session talking about equity and opportunity. Let's talk about that in the context of COVID and how this, how this affects us, again, around the world, but especially here in the States, based on race and gender. There are differentiations. And maybe, Bill, maybe you could handle race and Melinda gender, but maybe you could delve into that a little bit.
Well, yeah, it's certainly troubling that where the disaggregated data's come through, it does show not only the age thing, which is number one, and the comorbidities at number two, but also a significant racial component. And that's likely to be multifactorial, partly general health condition to begin with, partly job type, household size, multi-generational household, living in the dense parts of the urban areas. And, we're also looking at, all sorts of medical things. What is it that we can intervene to cut this down? So if in advance, if you'd asked, would there be different outcomes by race, we would not have expected that. It's a, stunning and disappointing result that we're seeing in many countries. The UK has seen this as well. For a while, the disease did not take off in Africa. Sadly, it looks like that was just a delay in it getting going, because now, despite the younger age mix, the cases in South Africa and other parts of Africa are taking off, even somewhat behind Asia and South America, but still with a very, very scary trend. So, there's a lot to be done on the intervention side to reduce that exposure, to prioritize the protection that the inner city communities deserve on this.
Yes, and I was just going to add on the race. I think also it's exposed for us the gaps in our healthcare system. You are not treated equally in this healthcare system, and that is something that needs to be fixed. On the gender side, I think, again, it's exposing the gaps that were already there that we so often as Americans don't want to look at. So just to give you some statistics, women are losing their jobs at a disproportionate rate to men. A lot of it has to do with the sectors that women work in, like retail and hospitality. But even as people start to go back to work, fewer women are coming back to the workforce as a percentage compared to men. So those are the statistics for the United States. Now, the other issue that's going on is we know women are doing 2.5 more times unpaid labor at home. And they and their husbands are reporting that when it comes to teaching the kids, trying to make sure they're online, fixing the meals, cleaning up, babysitting the kids, caring for the elderly, women are doing that more at home, whether you're a white collar female worker or whether you're a person who lives in the inner city and you get on the bus to go to your job. And so what it means is that we cannot reopen this economy the way we want to unless we deal with the unpaid labor. And we are the only industrialized nation in the world that doesn't have a paid family medical leave policy. That's just the truth. And so we have it now in 8 states and in DC. We finally have it for federal military workers. And you saw Congress address this in 2 of the stimulus packages. But we have to update our thinking and realize that we're not in society anymore where the man, if it's a 2-person headed household that's married with a child, it's not that the man goes off to the work and the woman stays home with the children. That was what was going on at the mid-century. But today, of most married families with a child, 64% of them both go out and work. So if we're going to take care of the family and take care of capitalism and the economy, you've got to address that issue. And it is absolutely addressable. Many, many countries have done it with finesse. There are many great policies out there. In the United States, it's time we did it.